The opinions and views expressed by guests on the Golden Nuggets Health and Wellness shows do not necessarily reflect the views and opinions of the host or those of the station. Additionally, any medical advice shared by guests is not intended to replace the advice provided by your healthcare providers. It is important to exercise discretion and take responsibility for your own health choices. While the Golden Nuggets Health and Wellness shows aim to provide valuable information on holistic health for the mind, body, and soul, individual circumstances vary, and what works for one person may not be suitable for another. Viewers and listeners are strongly encouraged to consult with qualified healthcare professionals, nutritionists, or other relevant experts before making any significant changes to their lifestyle, diet, exercise routine, or adopting new practices discussed on the show. These professionals can offer personalized advice based on your specific needs and health status. The host, guests, and producers of the Golden Nuggets Health and Wellness shows disclaim any responsibility for consequences arising from the use or misuse of the information provided. By engaging with our content, you acknowledge that it is not a substitute for professional advice, and that you will seek guidance from qualified professionals as needed. Thank you for being a part of our health and wellness community.
Welcome to Golden Nuggets Health and Wellness Show, the television program that's redefining self-care for the mind, body, and soul. I'm Dr. Elect Starr, licensed mental health therapist, health and wellness consultant, and your host for this show. Our mission is simple: to empower you with creative and innovative self-care strategies that help you prosper and be in good health even as your soul prospers. We're so excited that you have joined us for our third season, The True Meaning of Resilience, turning lemons into lemonade. Throughout this season, we're not only identifying self-care strategies for building resilience, but also we're sharing testimonies of resilience and its remarkable ability to transform lives. In each episode, our guests will share their lemons, and they're going to share how they squeeze them into lemonade that's refreshing, inspiring, and impactful. I love what Elizabeth Kubler-Ross said. She said, "The most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depths. These persons have an appreciation, a sensitivity, and an understanding of life that fills them with compassion, gentleness, and a deep, loving concern. Beautiful people don't just happen." And joining us today is one of those beautiful individuals in the person of my beautiful friend, Krista Anderson. Welcome.
Thank you, Dr. Starr and my friend. It's so nice to be here.
It's wonderful having you, and you look absolutely beautiful.
Had to match you.
Well, you know, I used to always say, you're my beautiful friend inside and out, and I still mean that today.
Thank you.
So I know about you, but our audience doesn't know you. So would you share a little bit about you and what you do?
I would be happy to. Thank you. I am a licensed marriage and family therapist, and I work here in Indiana, but I do a lot of coaching. I also am a mindfulness/meditation coach. And that is probably the gist of what I do. It helped me found, and trademark the way I work. And it's called Emozen. And it's a way to find emotional zen through assertiveness, mindfulness, meditation, prayer, consistency. And that's what I think we forget when we're healing mental health, because we work with people, but we don't see the organ that we're affecting.
Wow.
It's the brain. So.
Absolutely.
Yeah.
Well, thank you for making a difference in people's lives.
Thank you. Yes, it's paying forward. It's turning pain to power, pain to purpose.
I like that.
Yeah.
And what I'd like for you today is to tell us your story of bitterness, the lemons.
Yeah.
This first segment is all about sharing the lemons.
Yes.
Your difficult journey, some of the things you had to struggle with that brought you to who you are today. And then the second half, you'll share how you squeezed those lemons into lemonade. So share with us your story.
Thank you for this opportunity to do that. It's interesting. We don't realize when we're children that we're probably, a lot of us, I should say, grow up in families that are pretty dysfunctional, right? Dysfunction, birth to age 7 is when our core characterological structure is established. And I saw a lot of physical abuse. There was a lot of emotional neglect. And I say this with healing love. This isn't about degrading anyone in my family or anything. I love them, and I was hurt by some of them, right? And I think that's true for a lot of us. But growing up, externally, you would not know I was traumatized. But until I started school, I didn't even know I was liked. So I really appreciate you calling me friend, because friend is so important. And then, when I got into grad school and we started doing, I jokingly say this, but maybe 1,000 genograms.
It felt that way, didn't it?
Yes, it did. A genogram is a family therapy tool, right, to track family dynamics 3 generations back. And I realized that the female line on my side was really toxic. And so I am the change agent in my family. And when you go through this healing process, you literally, when Pandora's box opens, it's really important that you understand that you are the one you've been waiting for.
I like that.
It's really important to know that when you are in the darkness, you have to know that you're the light. You can't see how bright you are until you're in the darkness. And so I realize part of the CPTSD that I have been healing is minimization. And I attempted suicide. That's the big lemon that I had. And it was 20 years ago. I attempted suicide. I was in ICU. I wasn't in therapy. I didn't talk to anyone about it. And when I was in the hospital, because of course I'm not going to go home. And what people don't realize is that when you have trauma, your limbic system, your vagus nerves, your brain, it is damaged.
Absolutely.
And to ask someone or to say to someone to get over it, or you're fine, it happened years ago, is akin to telling someone with a compound fracture to walk to the emergency room and to quit whining and to go handle it.
That's a good analogy.
Right. It's very serious. I want to stress how serious trauma is.
Yes.
And
thank you for stressing that.
Yes, you're welcome. And thank you for giving me the opportunity to stress that. And for women, a lot of times the rage that comes up when you're healing trauma, there's no place to take it. So rage does have to be addressed.
Absolutely.
And in a safe container with a safe other and someone else who has gone through it, because a lot of clinicians don't even understand. There's a saying in our profession that you can only take a person as far as you've gone yourself.
That is so true.
Right? And I kind of laugh with some of my mentors about, well, I guess I can take them to the edge and come back with them.
You've been there, haven't you?
Yes, I have. One of my mentors who also has been there was telling me about a dream he had at one point, and he was drowning, and he was at the bottom, and he turned around and looked up, and all of his clients were coming with him.
Wow.
And he said, but do you know what that meant? That I was still deeper than them and ahead of them, so I could still help them. So there's I was going to say facade. That's not the right word. It's not coming to me. There's a misconception out there that therapists don't need therapy.
That is so true.
We are human beings, right?
Yes.
You're going to tell a cardiologist he doesn't need to get his heart checked, or a physician that they don't need a yearly checkup. I always tell people, if you go to a pastor, a therapist, any doctor that won't go to their own therapy or that shuns it or makes fun of mental health, turn around and run the other way. Do not walk, but run. Because there's a part of them that is not going to be able to help you in those darker spaces.
Beautifully put.
Thank you. Thank you.
Wow. Thank you for sharing this powerful story. And that rage, I'm hearing that a lot. That rage is very much a part of trauma.
Yes, it is. Yes, it is.
My goodness.
There's, once rage is healthfully addressed, though, a person's energy, healthy energy returns. And I wrote this down because I say it a lot, but I want to make sure I say it correctly here. There's a loss of hope until trauma is addressed. And that loss of hope under that is anger. And behind that anger is pain. And behind that pain is the source of emotional torture that you have survived, usually from long ago. But the thing about trauma is it doesn't tell time. So when you get into a relationship with someone, love brings up anything unlike itself to heal. And usually we're projecting our childhood wounds onto our partners. And it's not, like, our feelings are always valid. Always, always, always. It's our conclusions about our feelings that are wrong.
I like that.
When we're traumatized. When we're traumatized.
I like that.
Yeah.
I know that the second half you'll be sharing how you squeeze those lemons into lemonade and how you're making a difference right now. But I really appreciate all the nuggets that you're bringing in this story of bitterness. And looking at you, I mean, you look absolutely amazing. Do you have people that question whether or not you truly get them? Because you don't look like what you've been through.
Well, thank you. Thank you. That's interesting. Some of what I've been through you can see in the brain scans that I've shown you.
Tell us about the brain scan.
Okay, so there's a trauma diamond that happens. And I know you can't see it on here, but I want to show you, and I can hold it up here in a second.
They have it on the screen, too.
Okay, this is an image of a healthy brain. This is a brain on trauma. That's active with trauma. These are SPECT brain scan images from Amen Clinics that I picked up off the internet. However, this is a scan of my brain. So what's happening, this is the top-down view right here. And that's my brain that was scanned in 2021 at Amen Clinics. And notice the prefrontal cortex, there's no activity here. That's due to mindfulness, meditation, prayer, biofeedback consistently.
Say that again. Those interventions that you use to help you heal. Mindfulness.
Biofeedback.
Biofeedback.
Prayer.
And prayer.
Consistently.
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 We hear that.
Consistently.
Consistently.
Yes, that's the key
Meditation, which is powerful. Oh my goodness. Biofeedback and prayer. Very powerful interventions. And you're saying those three things brought your healing.
Consistently.
Consistently.
Yeah.
Yes.
Because what happens is, I was talking to my daughter. She was nervous about going to college years ago. She's 26 now. I'm sorry, I'm at the age where I don't remember how my kids are. But I said, here's how you do it. Okay, stop thinking about college. Sit with me. You got to get somatically present in your body because that's what trauma does. It takes you out of your body.
I don't want you to rush through this, so can you come back the second half and share that piece? Because this sounds really good and I don't want to stop you. So we're going to pause. We're going to take a break and stay tuned. We'll be right back.
Dr. Starr, best-selling author of Golden Nuggets, Food for the Mind, Body, and Soul, is also a health and wellness speaker and consultant who provides motivational speaking, training conferences, and one-on-one coaching to improve the quality of life. She's passionate about helping people heal from the inside out. Dr. Starr provides creative and innovative self-care strategies that empower you to prosper and be in good health, even as your soul prospers. Call or visit the Golden Nuggets website today. Feeling anxious? Perhaps you're dealing with a past trauma and don't know where to turn for help. Turn to Unlimited Possibilities. We provide a safe and caring space for individuals and families to help improve the quality of their lives. Whether you need help with spiritual matters, trauma, depression, and more, Unlimited Possibilities can help you overcome your situation with compassion, acceptance, respect, and empowerment. Unlimited Possibilities, where all things are possible if you believe. Call or visit our website today.
Welcome back to Golden Nuggets Health and Wellness Show. For those of you just tuning in, I'm Dr. Elect Starr, and joining us is my beautiful friend, Krista Anderson. Before she comes to share how she squeezed her lemons into lemonade, I'd like to share some information with you about resilience. Resilience is the ability to cope with and recover from setbacks. And with practice, anyone can become resilient. Isn't that good news? And more than anything, resilience comes from mindset. By controlling how you think about a situation, you can control how you respond to the situation. Here are 4 self-care strategies for building resilience. Number 1, focus on what you can control and accept the things you cannot control. Number 2, adopt a growth mindset. View your hardships as opportunities for growth. Just ask yourself a question. What can I learn from this? Number 3, seek support. You can gain new insights or ideas to manage things better. And 4, face your fears. This builds confidence. Avoiding fears leaves the problem unresolved. And now that I've shared those golden nuggets with you, I'm going to turn to my friend Krista and just ask Krista, just how did you turn your lemons into lemonade? What did you do? What actions did you take?
Thank you for that question, because when you're in that healing process, you just know you're doing it because you want to feel better. Right?
Absolutely.
And so one thing I did when I was in the hospital in recovery from my suicide attempt, I realized that I wasn't satisfied with the mental health support or lack thereof that I was getting. I don't mean this in a negative light. Things have changed a lot,
yes.
Right?
Thank
in
God.
the last 20 years, yes, because we know more about the brain. But I applied to graduate school at Christian Theological Seminary while I was in the hospital still.
Wow.
And I received permission to leave the hospital to go for my interview at Christian Theological Seminary, aka CTS, it's shorter to say that. And I was accepted. So my suicide attempt was in January of 2024, and I started graduate school in the family therapy program at Christian Theological Seminary. And I learned a lot about that. I also was going through a divorce at the time, because one of the things that happens when you start to heal you realize, well, we're not healing to function better in dysfunction. We're healing to live vibrantly and alive, which is our birthright, right? And we realize sometimes the relationships in which we were involved don't support our continued healing. And so that's a hard part, of, I had a client recently that he had gone to his doctor, and his doctor had said, it sounds like you're doing really well. He said, yes, but I'm not in the environment any longer. Mm. And she said, I'm not in the habit of prescribing medication for people's environments.
Wow.
I love having prescribers out there that understand that.
Absolutely.
So, and I understand too, it's not their role to talk them through it, it's ours. So that's what we're working on, and discipline is much greater than motivation in that situation. So through grad school, I understood the process. I understood the psychodynamic reasons for regressing when you get stressed, right? And it's because trauma doesn't tell time. So for instance, if every Christmas, my grandmother made cinnamon rolls, right? And when I'm 7, she has a heart attack and dies.
Oh my.
That didn't happen. I'm just using that didn't happen. That's just a story, right? To express what I'm saying about trauma. So let's say, fast forward, I'm 30. which I'm not anymore. I'm in the mall with my kids at the food court, and I smell cinnamon rolls. That because trauma doesn't tell time, that injured part of my psyche has what people call a flashback, but it's not really a flashback. It's the body trying to play out the trauma, right? So in order to do that, I had to learn through practicing biofeedback. I went to California with HeartMath and spent an immersive there to learn biofeedback through HeartMath. And they don't really call it biofeedback, but that's what it is. And what biofeedback does is it helps you regulate. It's a bottom-up approach. And what I mean by that, like cognitive behavioral therapy is a brain approach. But if you're traumatized, you flip your lid, your prefrontal cortex goes offline. You don't have access to your brain any longer. So emotional regulation is key for patients that have complex trauma or post-trauma, right? And it's not really a disorder either. It's the body's natural defense against emotion that is too much for us at that time. And so again, education, practice, self-awareness, and it's a daily practice because the goal of healing trauma is to reconnect the thalamus and the amygdala. And you can't do that if your prefrontal cortex is offline. So I had referred to my prefrontal cortex in that top-down view of my brain. My prefrontal cortex stays active. My prefrontal cortex, I'm a walking example of what research has shown about mindfulness and meditation, increasing the size of that so that you can stay present to things that used to terrify you. But we wouldn't necessarily call it terrifying, right? Because it's normal. It's like this. You can't see it. It's like the octopus stuck to your face, you know? It's all these arms are running around and people are going, no, that person has an octopus stuck on your face. But obviously I'm joking, but that's what trauma is like. You can see, oh, you're not okay, but you feel okay because you're so used to it, right?
I like the way you put that.
Yeah.
Use a lot of analogies, I see.
I do.
Makes it clear, right?
I
Helps
hope
people
so.
understand.
Yes.
Well, you know, Krista, looking at you, as I said earlier, there's no way people could see that, your past. How do you use your lemons today as lemonade for others? Tell us some of those things you're doing with your lemons now.
So I believe there's no place more sacred or holy than where an ancient hurt has healed. And in my maternal line, there is a lot of toxicity. It stops with me. I have a wonderful relationship with my daughter. And I now live with my mother who has dementia, and I am her caregiver. So I have opportunities to practice daily because she and I, while I love her and I wanted to be just like her when I grew up, we had a lot of difficulties, right? And so it's an honor for me, it's an honor for me to be able to care for her.
That's beautiful.
And I also am a full-time therapist. I meet with clients virtually and in person. I'm not traditional in the sense that I don't look like this when I do therapy. You know, I'll have a hoodie and leggings on and running shoes because we might go for a hike. We might have a 20-minute meditative walk, and then we start therapy, right? Or we sit and talk in my office. We might order a pizza, right? It's that connection. It's that therapeutic alliance that's really healing.
Absolutely.
And so I do use my own practices, and it's through creating emotional zen. Like you can feel a flow when you get there. I'm sure you felt that, right?
Yes.
When the healing happens, there's a connection, an energy. Yeah. There's a heat for me.
Absolutely.
That shows up. And then the client can release. And what I do, therapy is like a dance. It's like a beautiful dance. You have to know how to work with and walk with your client's emotions. And you can go very deep into grief. And once they've released that, appropriately so, you can incorporate laughter, right?
Yeah.
If you know what you're doing. And One thing I think a lot of clinicians are afraid of the concept of suicide.
So, Krista, your story is amazing. I have a question for you. What is your view on suicidality, being selfish? Some people see individuals who are experiencing suicidal attempts as being selfish or what is the other word? I've heard cowards.
Oh, yeah.
Have you heard that one?
Yeah. Yes.
What is your thought on that?
Oh, thank you for asking that question. I believe, this is my opinion, that it's more cowardly and selfish to have a family member or loved one that you know has been diagnosed with severe depression and suicidality, and to not understand the medical condition that is depression. If your loved one had cancer, you wouldn't say, get over it. You wouldn't call them cowards for being afraid. And that goes back to, you can't see the damage that is done to our nervous system when we're traumatized. It literally causes brain damage. And I believe I referred to this earlier. The goal of healing trauma is to reconnect the thalamus and the amygdala, because without them connected, that trauma, I mentioned the cinnamon rolls earlier. If the thalamus and the amygdala were connected, I would smell that and be like, oh, that reminds me of my grandma. And I might sit down and cry. But when they're not connected, the amygdala takes over. And the amygdala is like the smoke detector in your home. It's always searching for things that can be potentially dangerous. And in people with trauma, me, it's enlarged because it is taken on extra responsibility, right? And so when that's not connected, I smell those cinnamon rolls. My amygdala goes, whoa, whoa, whoa. The alarm, that was an alarm. And you have what people call a flashback, right? So
Yes.
I know I'm talking about depression and trauma, but depression is a result of trauma, right?
Yes.
And so my belief is that, again, I want to state clearly, for clinicians that don't understand suicidality, they need to immediately refer out. There are three things.
I agree.
Yeah, that clinicians have to be aware of: a means, a plan, an intent. And the biggest support for someone who is suicidal is to talk about it directly.
Well, thank you so much for sharing that. I just appreciate you being here.
Thank you.
I appreciate your wonderful story, so inspiring.
Thank you.
And I'm sure that our audience also has enjoyed you today.
Thank you.
So thank you for being with us. And we want to just encourage you that when life throws its lemons, make lemonade. Thank you so much. Bye for now.
Dr. Starr, best-selling author of Golden Nuggets, Food for the Mind, Body, and Soul, is also a health and wellness speaker and consultant who provides motivational speaking, training conferences, and one-on-one coaching to improve the quality of life. She's passionate about helping people heal from the inside out. Dr. Starr provides creative and innovative self-care strategies that empower you to prosper and be in good health, even as your soul prospers. Call or visit the Golden Nuggets website today.